Welcome everybody to the Housing First Europe Community of Practice Housing First Managers webinar. And the theme for today's webinar is recruitment and well-being in Housing First teams. Just a few words about the Housing First Europe Hub. So we are a hub, and at the moment we consist almost 50 organizations all around Europe and as far as Australia. And then the main idea is still, of course, to promote the housing first model and the systemic change within it so that we could prevent and end homelessness altogether. And then we have different work groups which consist advocacy, training, practice, research, support, and communications. And if you find any interest taking part one of the groups, please feel free to send an email to me or Leonie or Arturo, who is coordinating the Housing First Europe Hub, and we make sure that you get in contact with the right person. But today's theme, recruitment and well-being in Housing First teams, it has been a quite hot potato around Europe, around the world. And there has been a lot of discussions how we can get more people working with the Housing First, and also how we can make sure that those people also stays within the Housing First, so there is not this kind of revolving door issue within the teams and within the field. So it's my absolute pleasure to welcome our speakers for today, Rachel Marshall and Connel McKenna, who will explore their ideas and visions regarding these teams. And then the structure will go that first Rachel will give her presentation, and after that you can share questions for Rachel, and then Connel will do the presentation, and then you can ask questions from Connel. And then after that, if you have questions for both of the speakers, the floor is yours. And that you can put the questions on the chat box and I can read them out loud, or you can just raise your hand and I can give you the permission to ask the questions. And I hope we will have a really good and educating afternoon or morning regarding where you are. But first, Rachel Marshall is a policy and best practice manager at the St. Martin in the Field charity. Rachel communicates with frontline homeless workers through the Frontline Network, sharing learning to influence local and national decision-making. This includes leading the annual UK-wide Frontline Worker Survey. And then before joining the St. Martin's charity team, Rachel worked in social policy research and evaluation in the public and third sector, as well as delivering local community projects. So it's an absolute pleasure to have you here today, Rachel, and the floor is yours.
Thank you very much. Morning or afternoon, everybody. It's really good to be here discussing what is a very important topic. So what I'll be doing today is sharing some of the learnings from our Frontline Worker Survey, which is an annual UK-wide piece of research that we do. And the aim of that really is to gather insights from frontline homelessness staff and then share those back so that it can inform policy and practice around homelessness. So hopefully my presentation will be kind of useful setting the scene and context and sharing also the insights that we've heard directly from frontline workers in the UK. And then hopefully it will flow nicely into Connel, who can speak about the reality of that in an organisation and the kind of how that's playing out in the kind of service that he's working in. So I will share my screen and get started with my presentation. Hopefully you can see that all okay. So just before I kind of launch into the research findings, I thought I would give a kind of brief overview of St. Martin in the Fields charity, because people may not be familiar working in a European context. So we're a UK-based homelessness charity. We do a few different things. Part of it is kind of providing emergency funds for people so that they can access accommodation or prevent eviction. Part of it is also complementing that, working quite closely with frontline homelessness staff across the UK. So we facilitate something called the Frontline Network, and that is again, UK-wide network of staff who are directly supporting people facing homelessness in their roles day to day. And we have a broad definition, so it could be anybody working in the public, statutory, voluntary sector, in roles like outreach, could be housing advice, probation, social work, more kind of health-focused roles. So it's a really wide range of staff, and through the network we offer funding to enable them to do their work, community, so we host events, bringing people together to discuss issues, and then resources. So the kind of aim of the network is to help share that good practice around what's working and what do we need to kind of scale up, and feedback also to policymakers so that we can make changes there too. So that's a bit of context, and we work UK-wide, but we also have a number of partners who do things more locally across the UK. So these are some of the brilliant organisations that we work with there. So that's kind of intro to the charity. I'll move on now to talking a bit more about the Frontline Workers Survey. So this is a piece of work that I lead, and it's an annual piece of research that we do to hear from frontline staff. So the most recent survey was undertaken in November and December 2022, so coming up to nearly a year ago, and we received responses from over 1,000 frontline workers, majority based in England, but also kind of representation from the other 3 nations. So we're trying to go UK-wide approach, and I guess to kind of delve a bit more into where those frontline staff work, you can see this chart on the right hand side of the screen. So most commonly we had people participating in the survey from supported housing, advice services, or resettlement, tenancy sustainment type services. We had a whole range, and some people were working in quite general support roles, but some were had kind of specialist responsibilities, so maybe working with a particular demographic of people, or focusing in on a particular thing like debt advice or health, mental health, kind of welfare benefits, different specialities. So it's quite an interesting mix of people who took part in the survey. And another thing to kind of highlight about the participants is that we had 1 in 5 people kind of state that they had previously or currently used homelessness services themselves. So they're obviously, these people are speaking from a professional experience, but they also have all of those personal insights of the realities of homelessness as well, which are really, really valuable. So in terms of what the research looked at, it covered a few different areas, including people's experience supporting others to access accommodation and other services like healthcare, things like that. We looked in particular at the kind of impact of the rising cost of living on homelessness generally, and then also on frontline workers and their services. And then we also tried to gather some good practice and solutions. And then the area which I'll be focusing on in this presentation is around staff wellbeing and professional development, and linked to that kind of issues of recruitment and retention. So yeah, I'll mostly be talking about that last thing today, but if you're interested in those other areas, we have some reports on our website, and I'm also happy to talk more about those. Great. So I'll begin by outlining what staff told us about their experience working in the field of homelessness. And I guess the context of the timing is important here. If you cast your minds back to November, December last year, at least in the UK, I think we were facing a really difficult winter, and the impact of the cost of living crisis on everybody, you know, people experiencing homelessness and the services trying to deliver support was really profound. So what we kind of heard from frontline staff was that they were working under extremely challenging conditions. And I put some of the kind of headline stats here that demonstrate that. So we had 78% of frontline workers stating that demand for their service had increased in the last 12 months. So we're seeing a rise in demand, but at the same time, there are these long-standing issues around difficulties accessing suitable accommodation, difficulties obtaining mental health support, due to things like long waiting lists. So those are long-standing issues, but we're seeing that they are, you know, being worsened in cases with the impact of the rising cost of living. So this is really concerning to see, and throughout this presentation I've embedded quotes directly from frontline workers who have fed back and kind of are able to communicate the reality of this probably much better than I. But what this kind of means in practice for frontline workers, we heard, is that they have less kind of time and didn't feel like they had the resources to kind of do their jobs as effectively as they would like. So the key figure here is that 32% strongly disagreed or disagreed that their caseload was manageable. 40% strongly disagreed or disagreed they had enough time to do their job effectively. And where we've been asking some of these questions for multiple years, we're able to do a bit of comparison. So we can see that that 40% figure is actually worse than it was last year, which makes sense, I guess, when you consider the increased demand that a lot of services have seen. And so you can see in the quotes here, people saying that they're worried that things will go wrong because of the lack of time and the high demands. And they're also worried that it's going to lead to burnout of staff because of the stress, actually, of not being able to provide the support that they want to clients. And I guess to bring this up to date, so earlier this week in the UK, we had the publication of an independent report from the Kerslake Commission, which was a commission that was set up following the pandemic to try and kind of learn from the lessons of the response to COVID, and particularly around rough sleeping and street homelessness. So we know from that report, they kind of summarised the latest national official figures in the UK, showed a 26% increase in rough sleeping and the highest rates of people living in temporary accommodation on record. So I guess since the time of surveying, we know that the situation has continued to evolve and get worse. And so we'll be undertaking further research with frontline workers in the new year, but it's not kind of indicating that things are moving in the right direction. And then I guess another thing that we explored in the survey was not just the impact of the rising cost of living on homelessness, but also the impact on frontline workers themselves. And we asked a range of different questions and kind of heard that they were really being affected. So people saying, this is homelessness staff saying that they were cutting back on things like leisure activities to save money. They were struggling to pay bills. Some were taking on additional paid work to kind of help cover their costs. A particular kind of issue for people who maybe use a car and have fuel costs associated with their work, where they might be visiting people in the community or going out and about, especially in rural areas. We heard that people said that actually fuel costs related to their work, putting on an extra strain to their personal finances. So this is all really concerning and affects inevitably the well-being of frontline workers. And I think a particularly kind of shocking result that we found was that 32% of frontline workers stated that they were struggling to pay housing costs themselves. So even the people who are offering support to people facing homelessness, they themselves are in kind of insecure housing related positions. And again, you can see some of the quotes from frontline workers here saying that kind of their wages are being eaten into by things like fuel costs, that they're limiting how much they're putting heating on, that they've taken on additional work. So someone's saying they're doing Monday to Friday as a support worker, but then they do an extra 2 shifts in security just to be able to afford the basics. So this, I think, is really, really shocking and, inevitably has an impact on staff wellbeing. So when we look at staff wellbeing, we have interestingly kind of data for the last 5 years on this. So we can see a bit of a longitudinal trend, which is in the chart below. But in terms of the most recent results, we had that the majority, so 58% of frontline staff, felt that their role had a negative impact on their well-being. So in terms of how that's kind of changed over time, it's a slight improvement from recent years, but we can see that well-being is a long-standing issue in the sector. And I guess that's important for a few different reasons. An individual's well-being is obviously inherently important and we want it to be good, but when it comes to well-being within the homelessness workforce, we know that this kind of work can be particularly stressful or challenging due to the nature of the issue and where people might be talking regularly in their kind of day-to-day work about things like trauma and might experience things like compassion fatigue or vicarious trauma. We also know that with a lot of homelessness support, actually, like relationships and taking time to build trust with people can be really important. So if you have kind of staff who are burning out, leaving the sector, or kind of who are signed off unwell, then that can really impact the quality of support that's available to people. So I think on several levels, this kind of negative well-being that's being reported is really, really concerning. And I guess it's kind of most extreme. It's threatening to force frontline workers to leave the homelessness sector completely. So I guess we've heard a lot of kind of positivity in frontline staff who are really committed to working in this sector. People who really enjoy their work, they enjoy the relationships they build with people, and working in a team. People had like a really strong sense of purpose often, and they kind of fed back that they wanted to use their skills to make a difference, and sometimes they were motivated by the personal experiences they'd had. So there was a lot of positivity. I think increasingly we were hearing uncertainty about, despite the fact they loved the work, how realistic it was for them to keep working in the sector. And there were a couple of reasons given for this. So things like the impact of the role on their kind of mental health and well-being, but also some of those issues around low pay, lack of job security, not necessarily feeling supported enough by their organisation, and also feeling kind of frustrated or like disillusioned with the lack of systemic change, and the kind of the fact that housing and homelessness issues were perceived to be getting worse, despite the kind of work they were doing day in, day out. So yeah, whilst we had a lot of kind of passion come through and commitment from frontline workers, there were people who were really experienced, really skilled, really enjoyed their job, but who were uncertain about their future in the sector. And I think that's why it will be really good for us to speak more about what we can do to tackle some of these issues. So that's what I'll move on to for the second half of this presentation. And I guess to kind of state before I delve into it, I think it's interesting to consider two ways to approach this kind of issue of poor well-being or staff retention. There are actions that and that includes kind of different stakeholders, because some things we have control over as individuals, sometimes it will be managers, it might be organizational leaders, but also funders of services have a role to play, and definitely policymakers as well. So there's a whole range of stakeholders that need to take action on this issue. And there's, sort of two ways that it might be useful to think about it. One is actions that could reduce the stresses. So this could be things like lightening workload. And then the second is actions not to reduce the stresses, but just to deal with them. So you might think of an example like mindfulness, or something you can do that isn't necessarily getting rid of the problem, but it's helping you deal with it. And we might like to think about both of those different approaches when it comes to addressing wellbeing issues. So I'm going to go through a few of the kind of main themes that came out when we asked staff about what would be useful for them in terms of supporting their work. You probably won't be surprised to hear that funding was a really significant area, particularly with the cost of living. So as I mentioned, we'd heard how rising costs have really hit frontline workers and frontline services, and appreciating many of these services were already stretched to begin with. So we heard that frontline workers in their roles, they were struggling to cover costs such as fuel, even basic items such as food packages for people they supported. Some services even said that they were thinking of reducing what they were able to offer. Some closed completely. So frontline workers, therefore, were very welcoming of additional financial support for services to help address this issue. And examples of things that would be useful included specialist utility support for homelessness service providers, an emergency uplift to kind of help with the cost of living, and also uplifting the rate that is used to calculate cost of fuel and kind of uplift that to where it should be in line with the current cost of fuel. So yeah, the kind of issue of funding, I think, is really fundamental, and this is probably something that is less in control of organisations and more something that we need to talk to funders about. So things like having flexibility within funding agreements, or even kind of having that uplift just to deal with the kind of short-term need is really important. So funding was core, and kind of closely related to that was this sort of recommendation that there needed to be much greater capacity for frontline workers, so that they had the time both to kind of spend supporting people where they had high caseloads, but also to have time to use for their own professional development, and also things like having that time to step out of their day-to-day to collaborate with other services, or to go out and network and kind of meet other people, reflect, kind of develop their knowledge of the local area and what sources of support were available. That was also highlighted. And it was suggested a couple of different ways that this kind of greater capacity could be enabled. It's obviously linked to funding, helping to secure a full staff team, reducing caseloads ideally, and also minimizing time that's spent on administrative tasks. That kind of came through, and again, that might also be a conversation with funders, where there might be reporting requirements or particular ways of doing things that actually result in frontline staff taking quite time out of their, I guess, main focus of supporting people. And in the kind of current circumstance, we heard about people who didn't feel like they could necessarily take annual leave or sick leave even, because their team was understaffed, or they felt like they were indispensable and the kind of service wouldn't be able to operate without them, which is not sustainable. Another kind of key theme that came through when we were thinking about staff wellbeing and also retention in the sector was about training. So we heard that 44% of frontline workers said it was very difficult to have time to undertake training, and 30% said that securing funding for training was difficult. So it's linked to capacity, definitely. Some common feedback was that people wanted to kind of participate in training, but there wouldn't be someone to kind of backfill if they needed to step out from their day-to-day support work, so they didn't necessarily feel like they could. And I think also this kind of interesting discussion which is happening in homelessness, at least in the UK, is around qualifications, and frontline workers have a whole broad range of skills, but is it useful to kind of have something that's a bit more formal as a framework, that means that people can kind of go through and kind of tick off, these are the areas that I have skills, knowledge in, and provide some structure, and also provide some recognition for the work that frontline staff are doing. And in terms of what kind of areas of training, we did delve deeper into this. So I put on this slide the kind of top 5 areas where frontline workers didn't feel that they had the necessary training to be able to provide effective support. And so these are, from top to bottom, immigration advice, housing legislation, physical health, debt and financial advice, and leadership. So an interesting kind of mix of areas that have been picked up there. Some are quite kind of knowledge focused, and I guess the kind of feedback we heard there was that often these are like changing, best practice in these areas is changing. So when it comes to immigration advice and housing legislation, someone might have had a training 5 years ago, and it might be out of date, and they might not feel very confident on it now. Also we heard, leadership I think is a good example of a kind of softer skill, but something that frontline workers thought was important, and they thought they would like to undertake more training around. And I guess that kind of links to feedback we had about progression and kind of pathways through the sector, and people not necessarily feeling like there was a clear trajectory where they could gain more responsibility or specialize. but maybe that's something they did want. And so again, if we're thinking about how to retain staff, then thinking about that kind of those pathways for progression and development for staff, I think would be really helpful. And another kind of area that was fundamental was around pay and conditions. So frontline staff highlighted the need for better job security. So this kind of figure that 27% strongly disagreed or disagreed that they felt secure about the future of their job. And we had examples of people who were kind of on short-term contracts. They'd had them, they only had a few months that they knew that they were going to be in a job for, and then it was all kind of uncertain, but it kept getting renewed. And I guess that has the implications for the staff member and their ability to kind of be at peace and plan. But it also has direct implications for the service and the design of the service and the assurance that you can give to people who are coming in and accessing support. So job security is a kind of big factor. And as well as pay to reflect the rising cost of living and also the value and the difficulty of frontline work. And certainly in the UK this year, within the last few weeks, we've still been having strike action within frontline homelessness services, which are demanding for better paying conditions along these lines. And then the final area which I'll highlight in terms of recommendations is around organisational support. So staff raised the importance of having managers who really listened and encouraged their professional development, and actually having colleagues that they got along well with and they felt they could go to for advice. That was seen as really, really important. And we had a lot of positive feedback as well about where people were already working in supportive teams. So you can see in this quote on the left, someone saying, I have recently got a very good manager who is encouraging me, putting the steps in place to make sure my caseload remains manageable, whereas previously it had been extremely high and stressful. And that person saying that they're now a lot happier in their role and their well-being is better. So there's definitely tangible things that management can do in terms of their ability to support frontline workers, recognising challenges that they're facing, having good communication with them, transparency. Something else we heard was sort of having less focus on targets and kind of understanding and taking time to kind of listen and be flexible. And I think also we heard about, I guess, the role of management in kind of modelling good behaviour or kind of good practice when it comes to wellbeing. So they could often lead by example when it comes to talking about their experiences, perhaps, but also even kind of simple things like leading by example and taking regular breaks, so that it was kind of demonstrated that all levels of the organisation, wellbeing was taken seriously and there was space made for people's wellbeing, so that any kind of approach to wellbeing wasn't kind of tokenistic, but it was consistent across services and different parts of the organisation. Another kind of theme that came through around organisational support was the value of things like reflective practice, clinical supervision, flexible working, and even things like improvements to workspaces or kind of routines, the kind of design of roles. I think there's a lot of scope to explore these. I guess what I would say is that the important thing is to kind of listen here to the specific feedback of frontline workers, because there'll be many different organisations and different roles within that. For example, if your role means that you're mainly working alone, or if you have a particular type of service, that means there's particular risks or things like that. So if you are a kind of manager or in a leadership position, I think listening to specific feedback from frontline workers in your kind of team and creating wellbeing action plans or a wellbeing strategy with that team is really important. And then I'd say that also wellbeing isn't something that then be done and kind of ticked off. It's will constantly kind of change and need monitoring to understand, is this still working? Has the context changed? Is there a new issue we don't know about? So that kind of listening to frontline workers and the specific kind of feedback they have. And also what works for one person might not work for everybody. So for some people, they might find reflective practice really useful. For some people, they might find it a bit useful, but they might have other things that they would find particularly valuable to support with their well-being. So yeah, I think it's important to look at those kind of nuances as well. And I guess just to, before I kind of wrap up, the kind of underlying issue below all of these workforce issues, I guess, is that we need to see action taken to address homelessness, like first and foremost, because that would reduce the demand that frontline homelessness services are seeing. So we had lots of feedback, and we explored through other survey questions, what are the reforms and policy changes that you would like to see to prevent and relieve homelessness? So we have a whole kind of another report which is asking frontline workers feedback about this, and what needs to change about accommodation and kind of other support services. I think this kind of quote from a frontline worker in Scotland kind of summarizes it well when it kind of outlines that we need to be more human focused, less budget and cutting costs orientated. And we need to look at the big picture and the long-term preventative benefits of investment rather than always kind of fighting fires. And this was a common piece of feedback, is that people felt like they were having to respond to immediate crises, whereas they wanted to be doing work that was preventative and wanted to be spending maybe more time with people or time with people in a different way earlier on, so that it didn't escalate in terms of the situations people were facing. So yeah, the kind of report is on our website, where you can explore some of that feedback in more detail. But I will kind of round up there and just say a few kind of closing points on how we use these results. So I guess for us, the Frontline Workers Survey is useful both internally as an organisation, and then externally we try and share it far and wide. So internally, we use it to inform our work. So things like our training fund, which provides grants for frontline staff in the UK to undertake training, where they might be able to cover the cost themselves within their own organisation. That kind of came directly of when people had fed back to us through this survey that accessing training could be really difficult for financial reasons. We've also used the survey to inform the content of our annual conference, and actually that's an event that brings together frontline staff and discusses a whole range of issues. But we have recordings of those sessions on our website, so that is something that is freely available if you would like to have an explore. We've got a couple of different sessions talking more about staff wellbeing that might be of interest. So yeah, there's a few ways that it informs our own work, but then externally, my role is sharing these findings and I guess trying to influence wider change. So where there are government consultations, for example, we can share some of the evidence from the survey to try and highlight these issues, for example, around staff wellbeing and recruitment, so that people kind of hear directly from frontline workers, which I think is really powerful, and hopefully then take action and kind of address some of the issues that have been raised. So yeah, I will kind of wrap up speaking there. I think we have time for questions. I also welcome comments, especially if you are working in a different context and maybe have thoughts on, is this the same for you? Does this resonate with you, or are there different things that are affecting staff in your area, or are there solutions and kind of promising practice that you've identified? Yeah, happy to kind of discuss those points as well. If there's like a particular detailed question or piece of data you're interested in, then I can share my email in the chat, and I'm very happy to follow up after this presentation has ended. I'll stop sharing my screen.
Thank you very much, Rachel, for this excellent presentation, and I'm sure it moves the minds of people. And now it's, like Rachel said, time for comments, thoughts, ideas, questions. The floor is yours, and you can put them in the Q&A box or chat box, or raise your hand and I will give you the floor. So many different options for you. But maybe I can start. Just a quick comment, I would say probably that, it seems that the workers face the similar challenges as the customers in their job, basically. So the insecurity of the job, insecurity of the money situation, insecurity of the housing. Are they able to pay the rent or mortgage or whatever? So with all these challenges, it must be difficult to support people. So I was wondering, was there a correlation in the survey between how well-being of employees meets the job success in a way that, maybe keeping clients in the housing or something like that?
Yeah, that's a really interesting question. We certainly asked as another question, do you feel like your well-being affects your ability to do your job? Of which the overwhelming, I think 80-something% said yes. So I think there's definitely people who feel like because their well-being is poor, they are less able to to kind of deliver support. It would be interesting to kind of hear, to research that and I guess to get feedback from people who are accessing support. But I think intuitively we can say, if people are stretched and if they're worrying about other things, then it's going to be really difficult. I guess at the same time, you could say that where people, people 1 in 5 approximately frontline workers had experience of homelessness, and some of that might not, the majority of that isn't current. And I guess there are positives to that in the sense of people being able to be to really understand people and to give kind of advice and build relationships. Yeah, it's not a situation that we want frontline staff to be in, and it's really concerning. And yeah, from what we've heard from frontline staff self-reporting, it does affect their ability to do their job. But I would be interested to hear to kind of take a look at that from an organisation perspective and from the perspective of people accessing homelessness support, for sure.
Yeah, thanks. And then in the chat box, there is Kev Campbell saying thank you for the very, very good presentation. And he doesn't have a question at this time, but, reflect the views of the teams he's worked with. So yeah, similar things has come up elsewhere as well. But of course, there is also time to ask questions and share the ideas and comments after Connell's presentation. So if there is no questions coming straight up, I think we can move to Connell's presentation, and you can think about those questions and then have them after Connell's presentation for both Rachel and Connell. So Connell, please, the floor is yours. But before I forgot, I will introduce you properly. So Connell McKenna is working at the Simon Community Northern Ireland, and he is the Housing First for Youth Service Manager, and has been doing that job for 3 years. And previous to this, he has worked in adult homelessness and low threshold services. So thank you very much for joining us today. And now the floor is yours.
Thank you, Juha, and thank you for the opportunity to speak today to yourself and to the hub. So let me first just see if I can successfully share my screen here without too many technical difficulties before I begin to talk to you all. Hopefully, you can all see that. I'm getting the thumbs up, so that's good. Okay. So yes, good morning from Belfast, everyone. I hope that you can all understand my rather thick Belfast accent. I'm led to believe that it's quite a challenging one at times, so I will try to speak slowly and clearly as I possibly can. What I would like to discuss with you all today, I suppose, is, and to build on what Rachel spoke about there, resonating hugely for me, just listening to the feedback from frontline staff in particular, is a sort of a local focus within our own Housing First for Youth service within the Simon Community Northern Ireland, a practical and values-driven based approach to supporting and promoting the well-being of staff in order to support them to provide the really crucial and hugely important services they do to, in our context, some of the most vulnerable young people in society here. So if I can just mention briefly the Simon community before I begin, to get into the detail of Wellbeing and the Housing First service in particular. The Simon community have been in existence for over 50 years in Northern Ireland. We are the leading and largest provider of homelessness support services locally. Most of our services are sort of what you may call a traditional responsive approach to the homelessness issue, that kind of, residential homelessness or hostel-based services, low threshold services, drug outreach support, things of that nature. We are beginning as an organisation and have been in the last decade or so to move into a more, I suppose, preventative space. There's an increasing focus on that in practice and strategically. And the Housing First for Youth service that I manage is a crucial component of that. It's been in operation since 2017, and we've been proud members of the Europe Housing First hub since 2022. So, just the focus for me today really is to talk about really a promotion of culture of well-being within a staff team, and really looking at that as an extension of the empathetic approach or the empathic approach we take to, in our case again, young people. So that'll be a focus for me throughout the next 15 or 20 minutes if I can stretch it that far, speaking slowly. So our Housing First for Youth service, just to sort of explain what our staff team do and give a little bit of context to some of the challenges they face. We are an intensive and very highly person-centered service. We operate 24 hours a day, 7 days a week, 365 days a year. The service never stops. We are proactive and responsive. So we are an on-call service. We are, in many respects, a crisis response service, and also an outreach type of service for our young people across all hours of the day and night. But as Rachel alluded to previously, we do try to take as proactive and preventative an approach as possible to supporting our young people within the community, in order that we can avoid those kind of crisis response issues and avoid, I suppose, that becoming too dominant an aspect of the support we provide. We would rather be preventing than curing, I suppose, in a nutshell. But both components of the service are hugely important. Our young people, for example, they may struggle to engage with, the more traditional health services, even services like 999, call handlers, when they're in crisis. Their ability to phone us and our ability to respond to that type of situation effectively with the support of, say, emergency services or partner agencies is a crucial part of what we do. We support a very small group of complex needs young people who are aged 16 and above. So we do actually provide housing within the community and a 24/7 wraparound support to young people who are 16 or 17. So essentially children in the eyes of the law. So as you can imagine, quite a lot goes into that in terms of safeguarding, governance, and a really, as I say, person-centered and intensive approach to that type of model. All of our young people were previously in state care, so they are referred to us by social services. There's no self-referral mechanism to our particular service. All of these young people were living primarily in group residential settings, but some will have been through also foster care, some will have been through both, multiple placement breakdown, juvenile justice systems, secure accommodation. There's various pathways that these young people will come through, but all have come through state care. And really by the age of 16 or 17, when they're referred to us, possibly even beforehand, that system is not working for them and is not meeting their needs. That will often be due to the vulnerabilities they themselves have within those settings, but also on occasion it will be related to the vulnerabilities that they may impress upon other young people in the same settings as them. And our housing and support is delivered mostly within the Greater Belfast area using a scattered housing model, which some of you may be familiar with the terminology. So the young people that come to our service when they are housed, they are not in a cluster or group environment. They're all living in their own little independent spaces, small flats, small houses initially. Then we support them to become tenured, essentially, through the early years of sort of 16, 17, 18 plus, then leading to tenured accommodation. And our support continues in much the same vein post-18 and post-tenured accommodation. Our young people are referred to us by 3 health and social care trusts within Northern Ireland, the Northern Trust, the Belfast Trust, and the South Eastern Trust. So in our context, quite a significant geographical spread for our young people. But the young people are all housed in the Greater Belfast area, at least initially, until they get the opportunity to maybe make their own decision around tenure. And that's part of what they agree to when they enter into the service, is that availability of staff which housing them in the Greater Belfast area provides. We can't provide an intensive support service to young people if they're living, for example, 40 miles, 50 miles away from where we are based. That's just not really possible with our model. So the young people, while they get a large say in where they live and their specific living environment within the Belfast area, it is very much Belfast-based, the service we offer. And we are in partnership, as I've mentioned, with the local health and social care trusts, and also with the Northern Ireland Housing Executive, who are key. And they would be our local authority, I suppose, in terms of housing provision. They are key in providing the quality, effective housing that our young people require when they move into the service. So those two organisations, the Housing Executive and the Social Care Trust, they are partner agencies. They are very much key stakeholders in the service we provide. So that is our service. I'd like to move on now just to what I want to focus on today, which is the culture of well-being that we're trying to, I suppose, promote and develop and cultivate within our services. And I think it's important just to name, I suppose, this might look at a little bit of a negative slide, but it's important to name some of the stuff that our staff are dealing with on a daily basis. And I think Rachel's presentation again echoed some of this. And I think anyone here who's got experience of working with Housing First services, Housing First for Youth services, and indeed really any services working with vulnerable adults or vulnerable young people will have experienced these types of issues for staff teams or even personally themselves. You know, distress and trauma being a big one. Our staff members are carrying a lot of residual and, stress, distress, trauma of young people that is hugely complex in many cases, and indeed really beyond the ability of our staff teams, myself, whoever it may be, to really adequately treat. We're there to support, but carrying that and being there alongside the young people to emotionally support them is a day in and day out factor or facet of our work, I should say. Below that, I'll not go through these individually in great detail. I think they're fairly self-explanatory. But again, when we are working with young people who have that, that residual trauma, that experience of essentially systems, family members, society really letting them down, closing doors to them, moving them from one place to another whenever things aren't quite working out, not understanding them, not being able to walk along with them. These are some of the behaviours that may, face staff on certain days, blame and frustration, anger, aggression, abuse and assault. And then, of course, also because of the vulnerabilities and the complex needs of the young people we're supporting, our staff are routinely involved in supporting and caring for young people through things like overdose situations, self-harm episodes, suicide attempts. And again, our proactive and intensive support is really, really crucial there. In many cases, we are catching those incidents because of that proactive support, not because the young person has necessarily notified us that they're in that space at that time. And death, I do think, again, it's important just to name these things on occasion, folks. We have had a young person in our service, sadly, who did die 4 years ago. And I think we're all aware within Housing First Services that, again, because of the complexity of the people we support, that maybe that higher possibility of death, and because of the tenure of support, the longer term nature of support, services that support people who have maybe a long background in street homelessness and all of the health implications that go with that, staff will deal with death, and they will deal with the death of people that they are beginning, that they know very well, they're beginning to know very well. They've known for years in some cases, and they work with intensively. So just hugely important, I think, just to acknowledge that that's the reality for staff. There are loads of positives also to working with our young people and working on Housing First scenarios and services. But these are some of the things staff are dealing with on a daily basis, really. And that's why we have to concern ourselves with their well-being. Okay. For me, again, I mentioned the word culture at the beginning of my talk. That's what this is for us and for me at Housing First, for youth within the same community in Northern Ireland. It's trying to develop a culture of well-being and cultivate a culture of well-being within our services for our team. And what does that mean and how do we go about achieving it? Well, I mean, it's basic stuff, some of this, it really is. We talk about it a lot. We talk about every day within the staff office, with staff when they're on the phones in the community. We talk about their well-being. We talk about things that are impacting individual well-being, group well-being, the young people, the staff, we talk about well-being all of the time. And it's not just with a focus on young people. And talking about it means conversation. It means listening and adapting. The second bullet point I've mentioned there, we sort of enter into this. It's not just about talking about it and then doing nothing. It's, being able to hear, as Rachel mentioned in her piece, what the views of frontline staff are, and taking that seriously and really investing in an effort to make change and affect change that is going to benefit them where at all possible. It's, it's empowering for staff when they see that their voices are being heard. It indicates respect for them. And in a position like mine as a service manager, for example, or my own senior staff within the services, the ability to accept criticism positively, and treat it as positive and not treat it as a negative, is hugely important. That's how we improve. That's how we change, and how we really show value, I think, in the people that work with us and work for us. And having that humility of approach is crucial with that. A parity of esteem I've mentioned here between the well-being of staff and young people, that this can sometimes, in my experience, be a slightly controversial area. And I'll touch on this a little bit later on. When we're working in services that provide support to highly vulnerable people, their needs come first. Their well-being is the most important thing to us. That is why we are here. That is our mission purpose. But we can't lose sight of our staff and our people within that context. So really trying as far as possible to achieve a parity of esteem between our staff's well-being and the young people we support is crucial. And not having, I suppose, a huge imbalance where we're excellent on making sure the needs of our young people are met. We're excellent on making sure that their well-being is catered for. But what we're failing to acknowledge or do something about is the impact that has on the well-being of staff that are providing that really taxing work at times and taxing support. Accessibility, and approachability, well-being and welfare issues. I've touched on that already. I suppose that's key. It's key that we're creating for staff a culture whereby they feel they can speak, that it's not difficult, that it's accessible, and that I'm accessible in my role. The coordinators, the people above me within the SEMIN community are accessible and their voices will be heard, and that we're approachable, that we have time for them, that we don't relegate well-being and welfare issues below, say, completion of reports, meetings. If someone comes and they need that 5 minutes, that 10 minutes of your time, they've got it, and they've got it as soon as we can practically provide that. And we show that over time, and through repetition of that, the message really we find gets through to our staff that that's something we live and breathe. An organizational wide focus. So stepping sort of somewhat outside of our own service for the moment. This sort of stuff needs to be rooted in policy and procedure. That's something the SEMIN community in Northern Ireland have put great work into over the last sort of 3 to 4 years, and I'll expand on that a little bit later on. But it's not that we're working in silo within one service. Our organisation must support us in this, and the policies and procedures that hold our staff members to account have to reflect the supportive environment and the well-being culture that we're trying to drive. And I've mentioned it already, actions speak louder than words. Talking, listening, and then doing nothing, people will catch on to that very, very quickly. And speaking in the vacuums, no one wants to be doing that. So we live and breathe this stuff in our service. When staff give feedback, we seek to take action on that where possible, as quickly as possible. Just some of the key components I'm going to touch on next in relation to well-being at the SEMIN community and at our own Housing First for Youth service. So I'll touch on all of these in order: well-being champion, therapeutic care, practical support, and safe environment. So SEMIN community well-being champions. Every service within the SEMIN community, and we have close to 30 now almost, different services in the SEMIN community, has a nominated well-being champion, a person that requested to take up the role and was supported to do so by their colleagues and ratified in doing so by their colleagues. And really, in a nutshell, this seeks to empower colleagues to create well-being events, activities, and strategies that are meaningful to them. So what we're talking about here really is empowerment, ownership, and a bottom-up approach to well-being, developing well-being strategies. It's not doing to people and imposing upon people what you feel they require. It's them doing it for themselves together as a group and really feeding that up to positions like my own in management, for example. And what our wellbeing champion, Jennifer, who's been in this role over the last 18 months at Housing First for Youth, some of the things she has done. She's organised team building events and group recreation events and activities. And these have been both during working hours, and staff have been released during working hours to attend these, and also regular events outside of working hours, which are optional and are around just cultivating that team ethos and people getting to know each other better and enjoying each other's company. As I say, sometimes these things are quite simple and how they actually work for human beings. Also sourcing and signposting for staff members within the service who may be struggling or may, wish to explore other aspects of the support we can make available, holistic therapies and health and wellbeing support. I'll expand on some of those in due course. Advocacy is a huge one. I've mentioned that kind of empowerment and ownership and bottom-up approach. This role really is one that can push improvements to the working environment and conditions within services. They have a voice. The Wellbeing Champions have a group. They have a leader within that group in the learning and development arm of the service. And I meet with our Wellbeing Champion monthly, at least monthly, in order to make sure that things are being addressed and followed up on. And that person advocates for the group. And I think crucially, involvement in risk management strategies within service and within policy development also. So again, how can this wellbeing focus really impact upon the service we deliver, upon making sure we're effective in supporting our young people, but also keeping our staff safe and mitigating risk where possible. And also within policy development, the Wellbeing Champions within the Simon community, and including our own Jennifer within Housing First for Youth, have been part of a policy development group over the last year, during which they have had an active say in the development of softer, more staff-friendly policies and procedures that really echo the kind of culture that, as a Simon community, we are trying to develop and maintain. Something, Rachel, you mentioned in your presentation was reflective practice. So this is something that we have been fortunate enough within the Housing First for Youth service to have since we were commissioned in 2017. And it's operated in partnership with the Northern Health and Social Care Trust, one of our 3 Health and Social Care Trust partners, and the initial partner of the service from that health aspect. It's a monthly group session, and it's facilitated and has been since 2017 by a clinical psychologist from the Therapeutic Treatment of Looked After Children, or as we call them, TT-LAC, service of the Northern Trust. And participation for staff is optional. But what this does, this group, this space, is really give time for staff to slow down, think, reflect, talk to each other, or not. They can sit in silence. They can just listen. And try to make sense, as I put it here, of experiences and take learning from them, trying to contextualize some of the things they've experienced working with young people in recent weeks and months, things they've found really challenging, really difficult, either personally or professionally, even within their own values base. And it gives that space for this kind of conversation to grow and develop each month. And again, the optional aspect of this is really, really important. It's not something we enforce upon staff or that we do anything but gently encourage and I suppose advocate for the benefits for. And again, the staff team, the staff members who do attend the sessions regularly, we encourage them to speak to the staff members who don't and just impress upon them what they're benefiting from, why this might work for them, how this opportunity can be taken to actually help maybe improve some of the things they're struggling with within service. And it's non-hierarchical. This is crucial within this particular forum, but also something we try to softly implement outside of that where we possibly can. We all know there's roles and responsibilities. There is, in certain respects, a hierarchy in any service. But within this forum, when I attend it, I'm not speaking as a service manager to staff members who report to me on a daily basis. It's really there to speak as a colleague and speak as a professional and speak as someone who maybe, okay, in my case, it's reflecting back on time and frontline support work, but not driving that kind of hierarchical approach. It's a level playing field, and that's crucially important, and gives staff the space to speak openly and without judgment. Practical support to staff. I think I've touched on this already, so I'll not linger on too much of this, but I think it's really important that, as I put it here, people have support that they can touch and feel, that it's tangible, that it's not somewhere floating around in the ether, that we have all of these options and things we talk around, but we don't actually do anything with them or make them available to you. Salmon Community as an organization in the last 3 or 4 years has really started to invest strongly in accessibility, in a support pathway for staff, whereby staff have options and really, I suppose, meaty, tangible options to benefit their health and stay healthy and improve their well-being without necessarily needing to come through someone like me. So we, for example, have a Salmon Connects app, which is something that connects the entire organization of over 300 staff. And within that app, there's a number of things in relation to well-being and the health benefits that the organization offers. For example, we have a mental health helpline, a counselling and phone GP service, which are outsourced to agencies that work locally and also nationally in Britain. Though it's crucial that staff can really access and see a pathway to those without necessarily needing to approach me, needing to approach somebody in HR or in learning and development. It's there, it's at their fingertips. And also within the app, we have a sense of community, we have a sense of initiative and, I suppose, invigoration and drive. So when events are happening across the organisation, we connect that back into the Housing First for Youth service, because we are a province-wide organisation in Northern Ireland. So what's important for our staff is that they know what's going on in Derry, what can I become involved in Armagh, in Ballymena, all of these places most of you have never heard of. They're even smaller than Belfast. But it's crucial that as an organisation, people feel like they belong. All of these things connect to well-being. It isn't just the heavy stuff like counselling, phone GP, dental support. It's the softer stuff too. And our well-being partnerships locally really speak into that. Belfast Walks and Work Well, Live Well are two I've listed here. Belfast Walks are an orientation service and they're run by volunteers. And we actually have a commitment alongside with them to release staff quarterly to attend their sessions, normally in the Mourne Mountains, which are about 30 miles from here, during working hours. So staff are not expected are made available these opportunities on their own time. It's actually during working hours, and they're released to go off into the hills and get lost, essentially, with someone who knows what they're doing and how to find their way back and develop some orientation and team building skills and things of that nature. The Work Well, Live Well looks at holistic therapies, acupuncture, breathing, wellness, all of the kind of stuff that sort of falls within that sort of area. And again, they will actually visit our sites. Chest, Heart and Stroke locally here also visits sites on a rotational basis to conduct some physical health checks of staff, their blood pressure, iron levels, whatever it may be. So all of that stuff's really, really important. And we also take a proactive and responsive approach to staff welfare issues. So one thing I consider very important in my role is that I know my people, and that I don't require them to come necessarily tell me how they're doing. I can see it and I can feel it if they're struggling. That will not always be the case. So again, it's important that I and my senior colleagues here are approachable, that we have that culture developed and maintained and looked after. And again, things like supervision and debriefing after incidents are crucial. They're cyclical, they're standard for us. But it's really, really important that a staff member on night shift, for example, has dealt with an overdose or dealt with the aftermath of a suicide attempt or just a really emotionally taxing engagement with a young person, that they're getting follow-up. They're getting follow-up as soon as possible and that they feel that support. And just to mention also, because I think Rachel spoke on this currently really important issue quite strongly as well, hardship support for staff struggling financially. The Salmon Community have links to organisations locally that can provide expert support around, accessibility to benefits, entitlement, money management, and also we have our own hardship fund within the organisation to support staff and actually give staff that injection of financial support where required. Just lastly, in the four sort of topics that I'd mentioned a short time ago, a safe working environment. A lot goes into this, and I'll try again not to labour the point, but this is really, really crucial, and something we have to, again, as I would put it, live and breathe every single day. So security and inclusivity in the workplace. Again, if staff feel safe, and safe with a small s, not safe from harm, but they feel secure, they feel safe, they feel included, they feel a part of something within the workplace, it's a hugely powerful thing. When they don't, it's corrosive and it will not sustain. So how do we go about, again, making sure we're providing that or doing all we can to provide that? We provide a professional, trustworthy space and approach. We provide professional, trustworthy practice and conduct. Okay, so when we talk about things like confidentiality, policies and procedures in relation to staff welfare, we mean it. We follow up with action. We don't just talk about it. And through following policy, through following procedure, and through treating staff members as human beings and looking after their confidential space, and for our young people, when we're providing support to young people, we work within the boundaries. We show flexibility, but we don't step outside of what's safe, what's professional, and what's appropriate. And it's hugely important the staff come into work every day and feel that they're part of that type of service and type of environment. We maintain our standards within Housing First for Youth. We talk about our Housing First for Youth. That's our local service here. And that's slightly detached maybe from the core concepts and the core pillars of what a Housing First for Youth service delivers. It's what are our standards here within our own office space, within our own practice, within how we treat each other. An equitable approach to staff. So treating everyone in a similar way, but not necessarily in the same way. Making sure we're making allowances for staff members who require more support in certain areas than others. Consensus building or seeking practice. So again, not doing to people or dictating to people, actually where at all possible, and it isn't always possible, but where possible, seeking to build consensus around decisions, around change within the service, around how we work with one young person versus how we work with another young person, and really building that consensus so staff are on board with decision making and change really from the start where possible. We involve them in that. We talk about these things before we actually enact them. Team meetings, handover meetings, that type of thing. And again, I've mentioned the strength. I've mentioned already an equitable approach, a strength-based approach to skills development and team building. So again, where staff members are struggling in certain areas, we try not to focus on what they're not doing well. We try to focus on what they are doing well and how they can then build upon that while acknowledging areas for improvement. And again, it's looking at each individual staff member and focusing on their strengths, not the deficits of what they're bringing to the service. For any Brené Brown fans out there, if there are any among you, you may recognize rumbling with vulnerability. I suppose what this alludes to briefly, and it's particularly important, I think, at times in my role as a service manager and my senior staff, is just having that humility and that approach whereby we are not afraid to say we don't know. We're not afraid to say, I got that wrong. We're not afraid to say, you were right. And we're not afraid to sort of expose our own vulnerabilities, our own uncertainties, our own fears and anxieties even at times, because we come to work most days and there is at least one of our young people that we're concerned about. We're concerned, are they missing? Are they severely physically injured? You know, are they possibly even dead? But this is the reality. And if I don't feel that, there's something wrong with me. So I do feel it's important that within a staff team such as ours, we have an appropriate level of acknowledgement of our own vulnerabilities and our own imperfections. And again, that speaks into that hierarchical piece. And, you know, I think it's quite a powerful thing if we can make decisions and stand over decisions and explain why and not just how. People will respect that. You know, they don't need me to be a robot. They don't need managers or coordinators here to be robots or perfect individuals. They need us to be human beings with, you know, the skills to assess, you know, risk assess, make decisions, and then stand over those decisions and run with those decisions. And if needs be, to change, reverse, adapt. And that speaks into a dynamic and inclusive risk management approach. We are managing risk every hour of the day. We have to change that as the situation and the context changes. And again, making sure that staff are aware of the flexibility around how we manage risk and how we manage risk in a means to, or the means to keeping them safe in their role. Keeping the young person safe, yes, but also keeping the staff safe. So if I'm asking staff members to step into an unsafe space or to take a risk-aware and not a risk-aware approach, which we ask of them every single day, we want them to understand they can rely on us to appropriately assess that and really make sure that the risk we're expecting them to take is not disproportionate and not too high, and involving them in conversations and decision-making around that. And where necessary, making decisions that are related to their fears and anxieties in that moment. I've mentioned some of this already in relation to the organizational focus of the Simon community. But again, all of these things, they might not be obviously linked to well-being, but they contribute. So our onboarding induction process, including a peer mentor, is over 6 months. It's not 6 days or 6 weeks. Staff who come into the services are supported for a 6-month period, quite substantially. And again, that we hope aids their well-being, and that just continues even after the 6 months, it should add. A commitment to improving our people through upskilling and supporting access to education. Within my own team, approximately 30% of my staff team are currently in part-time education, and they have financial support by the organisation in almost all cases to do so. And they have flexible working measures in place in order to support them again to do so. They have reduced hours where they require it. That's a commitment that we make, and again, that's rooted in policy and procedure within the organisation. An enhanced budget for wellbeing events and opportunities for all staff. So again, this is something the Sendon community have committed to in recent years. And we have within Housing First for Youth quite a substantial budget, even by our own standards, around wellbeing events for staff. So again, just that organisational backup to some of the stuff we're trying to implement at ground level, that extracurricular stuff that goes around the work, but really forms an important part of making staff feel like they belong, that they're well at work, that they're safe, and that they actually enjoy working in what is often a very challenging environment. Rachel, again, you mentioned the improvement of workspaces and how that was something that people had really fed back in the frontline survey. We are going through a process within the organisation of that over the last sort of 12 to 18 months. My own workspaces here at Housing First for Youth are going through that process presently. And we are trying to adopt the psychologically informed environment approach, not just to where our young people live, and where our residential adults live, for example, in our homelessness spaces, but also for our staff, making sure officers are comfortable, bright, a comfortable, nice place to spend your time, not a cold clinical environment. And that's something that our wellbeing champion, again, leads on quite heavily, and the team really lead on and develop that. And a positive approach to flexible working need, I think I've mentioned already. And we really try and support our staff around their flexible working needs where at all possible. Very briefly, this is something we have on our wall, folks, in the Housing First for Youth office. It is not borrowed from a manual or a study or a model. It's basically my little thing. And it's how we look at well-being and team, and what team actually means. So looking at TEAM, trust, empathy, approach, and motivation. These are things we want to be looking at each and every day. Choosing to trust each other, not just building trust over time, but actually investing trust in each other whenever we meet new staff members, for example, supporting and standing up for each other. If we look at a staff member's decision the day before, we don't judge it. We don't begin to backbite about it. We try and understand the context they made that decision within, and we give them the benefit of the doubt. Really, really important stuff, because the opposite of that, again, is really corrosive. And again, teams can't really sustain that kind of lack of trust, that office politics, that backbiting type of environment. So we work really hard here to avoid slipping into spaces where that can prosper. The approach, we have an approach within Housing First for Youth that works with our colleagues in mind, and essentially that means we have a coherence around decision making. We have to be flexible, we have to be very person-centered, but we should always be making decisions that are not going to land our colleagues that are following us, in the muck, in the mud. That even if we have to step slightly outside of the lines, what we would normally do at times, we can explain it and we can stand over it. And we don't make decisions, as I say, that staff members following on from us are going to bear the brunt of in the shift that comes after. So that's just that commonality and coherence around approach, not necessarily consistency, because consistency would not allow us to be as person-centered and as flexible as we would like to be. And being conscious of what drives us as a collective. What is our motivation for being here? Constantly thinking about that and talking about that, because Rachel, as you outlined in your presentation, it's generally not about money. It's generally not about all the great financial rewards you will get as a support worker. It's about understanding what actually drives you to be here, making a difference in these young people's lives, taking a pride in your work, being part of a Housing First for Youth service that is part of, I suppose, the prevailing wind, preventative, earlier intervention, taking pride in that and really seeing the value in that, and it not again being an abstract thing. It's there every day. This is what motivates us to go out and do the difficult work that we do, and give our all to that. Again, all of these things, it's around team, it's around team building, yes, but it's also around our well-being. I just want to briefly mention some of the challenges, because these are real. Okay, and Rachel, you touched again on some of them, and I'm glad our presentations have hopefully complemented each other so well. these are things that do challenge us in terms of maintaining and improving well-being. All of the things that I've talked around in the last number of minutes, there's no magic wand. There's no easy fix. So we have to really work to, as I say, sustain and invest in the well-being of our staff constantly and be aware and awake to changes and challenges as they arise. The realities of the job I've touched on already. Rachel mentioned burnout. It's something that all staff are going to engage in, or not engage in, are going to encounter, I should say, on occasion, particularly longer serving staff and staff that are naturally inclined to go the extra mile. Ultimately, our young people do come first. I mentioned this in relation to the parity of esteem at the beginning. We have to make decisions, and I have to expect our staff to make decisions that may impact upon their well-being in order to secure the safety and well-being of the young people we support. So it's important that whenever we are in that space, that we're not letting a situation develop whereby staff feel undervalued. All that matters is the young person, the resident, the service user, whatever we call them. I don't matter. That's not a space we can enter into. But frankly, the young people do matter more in a certain respect. So it's getting that kind of balance right. The expectations of our staff team versus reality. I've talked a lot in the last short while about all of the things that SEM and Community and Housing First for Youth try to do to protect and maintain staff wellbeing. We can't always deliver upon that. Resource pressures, for example, financial pressures around, staff away days when we're struggling with annual leave or budgetary restraints and things like that. These things do come into play. So managing the expectations of staff can occasionally be a challenging factor. Team dynamics, there can be disruption, new people, people who aren't getting on so well, decisions that are taken people don't agree with. This type of thing, again, can challenge that kind of holistic environment, that holistic culture within the team. External factors, I think, Rachel, you touched on this really, really well in your presentation. These are things that are outside of anyone's control. So all we can do is be aware and respond and support. But again, if the majority of your team are dealing with stricken financial situations, health issues, family problems, health problems within their family, it's going to be really difficult within the workplace to maintain a happy, healthy environment. And we have to acknowledge that at times as well and see what it is that we can actually do to affect that. And recruitment and retention, I know it was a focus for today as well also. I'm just going to speak into that just finally before I finish here in terms of some of the impact and outcomes of what we've tried to put in place really in my 3 years here, and particularly over the last sort of 18 months to 12 months. So just some things we can point out tangibly. Job satisfaction, we survey staff through a Wellbeing Champion on a quarterly basis, and the most recent survey generated a score of 7 out of 10 among the staff team on average for job satisfaction, which, it indicates there's work to be done yet. But given also that we have to work in a very challenging environment, staff work night shifts, they work weekends, on social hours, all of the issues they deal with on a daily basis, 7 out of 10 isn't too bad. And it's certainly better than where we were a year back, which was 5 out of 10. So again, some tangible evidence that we're moving in the right direction, but work yet to be done. We have also, since July 2021, it's just over 2 years now, we have tripled the number of contracted Housing First for Youth support workers within our service. So we are seeing an upscale and an improvement in recruitment. There are other factors to that. We've expanded the service also. Funding has increased. We're in an unusually lucky space around that within Housing First for Youth here. But again, being able to recruit in, we've recruited people from other services within the SEM community. We've recruited people who have first engaged with us as agency or relief staff and who have wanted to come and work here. So I think that's quite powerful for me, that we're actually able to bring people in the way that we have in the last sort of 2 years, 2.5 years. And really crucially, retention. We now have 12 members of our current staff team that have been with the service for 2+ years, and that equates to roughly 75% of our team. 2 years ago, that was 0. We didn't have any staff in the service that had lasted 2 years plus. So again, we're creating a more healthy, I think, stable and safe environment for staff. And staff, through the evidence, want to stay. They want to work here. And what that leads to is a greater provision of support for our young people, folks. That's what it's all about. We now have 16 young people engaging and being supported by our 24/7 intensive support model across 3 health and social care trust areas. 2 years ago, it was 6 from 1 health and social care trust area. So we're expanding the service. We're providing a bigger and better service, I hope, to more young people. And that is really why we do this. So it's crucially important that all of this stuff connects to frontline service delivery. Thank you very much. That is everything I have to say for the time being.
Thank you, Connell. Really excellent presentation. And then if you're hiring, remember me. I think this was great, and complemented the Rachel's presentation perfectly. So thank you very much. And there was on the chat box, please feel free to share the questions and comments and ideas both to Connell's presentation and Rachel's presentation. But Leah, want to ask from you, Connell, that your staff, how much time do they have for training? I think you mentioned a little bit that, but if you can shortly answer to Leah's question as well.
Yeah, it was interesting. The challenge that Rachel mentioned, I think in her piece, very resonant for me, because we are battling the same resource issues as everyone else. I mean, even presently, my service is still only in and around 60 to 70% staffed. So it does impact upon, as frontline staff have mentioned, they want to go to training. They're keen to go and learn and develop, but that resource pressure can be difficult. Now, within the 6-month induction period that I mentioned, our staff, on all Simon community staff, actually, they emerge from that with an accredited qualification, a level 3 OCN qualification in homelessness support. So within that 6-month period, staff members will attend a monthly session. And it's various things around housing and benefits advice, needs assessment and support planning, naloxone administration. I'm sure we're all this time familiar with naloxone around overdose response and management. And it does generate that first step of professional development. Now, beyond that, we seek to ensure that every staff member in Housing First attends a training session at least quarterly. Now, that might not sound like very much, 3, maybe 4 training sessions a year for staff, but if they're full day or even 2-day sessions around important aspects, such as motivational interviewing. We recently had Lisa and Samara over from the Housing First hub to deliver Housing First specific training over 2 days, assist around suicide prevention, mental health first aid, a whole range of things that are really relevant to the job and to the work the guys do every day. If we can hit that mark of 4 sessions a year, we think we're doing okay, and that's the kind of mark we aim for. Ultimately, I would love us to be able to deliver more, and it's not always possible. It does just depend. I mean, I've had quite a bad month recently with staff sickness, for example, and that's impacted. So, yeah, that's what I would say in relation to that. I suppose as I mentioned, it's a stated commitment of the organisation. So, within our directorates, we're monitoring training attendance, both interior and exterior training attendance, and where we see that we're failing to hit targets, people like me are called in and explanations are sought. What can we do as an organisation to help you release your staff to train? So it is an important organisational focus, and we do succeed in getting staff to training regularly, but it's a challenge.
Thank you. And from my perspective, I only had a comment for you regarding that. I really like the part where you talk about, you need to take action, because at the end of the day, you can talk about these things hours and days after days, but if you don't do anything about them, it's just words, and words don't do anything without the action part. Same as when we're talking about ending homelessness. So without the action, that's not going to happen. Let's see if there is more questions in the chat box. And Simon from Belgium, she needed to leave a little bit early, but thought that both presentations were really good, and want to thank you both. And Kev Campbell, thank you so much, Connell. Your presentation really shows how much you value your team. At Turning Point Scotland, we follow a citizenship model which focuses on people's strengths and feelings, value in their roles, informing everything from policy to everyday interactions. Do you follow any particular model at Simon Community?
The honest answer right now is no. That's something we would need to develop, and I'd be keen actually to hear about the citizenship model that Turning Point use. So possibly if Kevin and I could link in after the webinar, I'd be keen to take that to our own HR and operational development and learning and development sections of the organisation. I think that's something that it's an area of service that we are developing in terms of how we invest in our people. So I'm sure they'd be keen to hear about that, but presently, no, there's no overarching model that we use, such as the citizenship model.
Great. And Connel, I think if you can put your email to the chat box so Kev can be in touch with you. And this is what it's all about. Saya and Rachel making connection and Connel and Kevin. So yeah, this is why we are doing these webinars to connect people and that's how we get the work forward in everywhere in Europe, hopefully. Yeah, I think people have so much thoughts in their heads that they will come back to you later on when they have some time to digest all the things you have just talked about today. And I think the both presentations have been really good ones, and I'm sure I will be in contact both of you and learn about more what you are doing regarding these things. But from my behalf, I want to thank you, Rachel, Connell. Thank you very much once again for being here today, and all the participants, thank you for being here today. And like I said, if you come up with questions later on, feel free to share them via me or straight to Connell or Rachel, and that's how we get the work towards the vision of ending homelessness in Europe. So thank you all, and we'll see you in the next one. So check out housingfirsteurope.eu with the next webinars and all the information needed. Take care.
Thanks, everyone.
Thank you. Bye.
Bye.